We can see this front. Oh, the just fell out. Hello? Okay, sorry. I'll start again. So, kia ora, hello and welcome. My name is Shivan. I'm an optometrist working in Aotearoa, New Zealand for about 6 years. In this video, we're going to be looking at Ali Abdaal and reacting to him getting laser eye surgery. A few weeks ago in a vlog, Ali Abdaal released a day in a life video where he actually goes in for a pre-operative laser eye surgery assessment. So I guess it'd be a good opportunity to check out the video, and we can sort of explain what goes on in a pre-operative assessment from an optometrist perspective, as well as at the very end, I'll talk about some pros and cons for laser eye surgery, because there's a tweet that if you continue on to the very end, we'll discuss a tweet that Ali put out about his fears of getting laser eye surgery, but we'll discuss it later on in the video. So let's jump in straight into that vlog.
Hey friends, welcome back to the vlog. So today is going to be a great day. We are on our way to Moorfields Eye Hospital.
So Ali mentioned Moorfield Eye Hospital. So Moorfield is a really prestigious eye hospital. It's known, recognized all the way around the world. I worked with an ophthalmologist who who was educated at Moorfield Eye Hospital, and he was probably one of the best ophthalmologists I've worked with. Not only from a surgical perspective or from what he's done, just from communication, and he's just a nice guy.
So we'll see what that's like. Toying with the idea of getting laser eye surgery. So this is an initial consultation.
What Ali Abdaal is getting done is a pre-operative assessment. So that's done always before any big surgery. That's just to make sure that Ali's a good candidate for laser eye surgery. Another thing I want to point out too is the differentiation between optometrist, optician, and ophthalmologist. So optician, optometrist, that's sort of used interchangeably in the UK. Typically an optician is really good with lenses and frames, and they're trained for this type of role. So an optometrist is more involved in primary care of the eyes, primary care eye disease or glasses, prescription, or if you need a routine checkup, that's what an optometrist does. An ophthalmologist is associated with tertiary care. So an ophthalmologist is a medical doctor who trains specifically in the area of ophthalmology. Ophthalmology, that is treatment of the eyes through surgery, medicine, and also diagnosing of any eye diseases. Now in ophthalmology, you can further subspecialize. So you can subspecialize with the retina, the back of the eye, vitreoretina, which is the middle of the eye, and the retina, all the way up to the refractive part of the eye. So that's things like laser eye surgery. Guys, it's me from the future. I also want to say there's optometrist, optician, ophthalmologist, and orthoptist as well on top of that. It's orthoptist, they really look at how the eyes work well together. They can do a similar job to an optician, optometrist for checking the prescription and making sure the eyes work together. Now back to the video. Being a refractive surgeon, and who's going to be hopefully doing the laser eye surgery. Not today, obviously.
Morning. We're here to see Ramesh. Name's Ali Abdaal. I'm sure I'll become a little bit nervous about it once I really think about it. But I've been nervous about it in the past, worrying about like, eyes and lasers and stuff. But then I've spoken to so many people who've done it, and they're like, it's such a safe procedure these days.
Yeah, so I think that's completely normal. With laser correction, it is surgery. Surgeries do come with risks, and with laser correction, it's something that can affect your entire life, especially with your eyesight and your vision being so important. So on screen here, you got all the lenses. All these lenses are used to check the prescription.
Well, I'm a doctor and YouTuber on the side.
So Ali's actually seeing the optometrist now. So what happens is the optometrist will do the initial tests, such as checking the prescription, asking the history questions. So for example, what do you do? And what will then happen is the ophthalmologist will come in and do take a look at the results, as well as the health of the eye. I guess Ali's talking about what he does because the optometrist asks. That's actually really important to know what the person does. So then you know what they're doing with their eyes all day. Plus it builds rapport, makes the person feel a bit more comfortable.
I can focus here. Beyond that point, there's bokeh.
So Ali is actually quite extremely short-sighted. Short sight just means that you can see up close quite easily. Well, in case of Ali Abdaal, it's up here, and things are blurry far away. The less short-sighted you are, the further what we call your far point will be. So if you're really short-sighted, your far point is up here, and if you're less short-sighted, your far point may be there. So in the case of Ali Abdaal, he's really short-sighted. If we get a photo of Ali Abdaal here, you can see that his eyes are quite magnified. So short-sightedness is usually corrected with negative lenses. And in the case of Ali Abdaal, his eyes are quite magnified. That means his prescription is quite high. Hopefully he'll be able to comment one day, but his prescription is probably about a -8. I'd guess about a -8, but it can be hard to tell just by looking at someone's glasses.
KVN. OKCZN.
So what the optometrist is doing here, he's checking Ali's vision through his glasses just to make sure he can see well with his glasses. The reason the letter chart is above his head, to test distance vision, you need at least 6 meters. Now, by having the chart above Ali, we can put a mirror at the end of the room. That means our room doesn't have to be 6 meters anymore. You can make it a 3-meter test room, but you still get the effect of being able to check someone's distance vision at 6 meters. That also explains why the letters are actually mirrored, because in a mirror, they're going to be the right way around. And you can see what the optometrist is doing now is checking the prescription. And you can see he's moving, the optometrist is actually moving that paddle up and down. I believe he's doing a cover-uncover test. That allows us to make sure that with the prescription, Ali's eyes are working together. There's no eye turn or anything like that. So Ali, looking at the prescription now, you can tell that Ali's got short-sighted, but he also has a bit of astigmatism too. So what astigmatism is, that means the eyeball, instead of being a perfect soccer ball shape, it has a rugby ball shape. Or if you're from the US, a gridiron ball shape. So instead of being a perfect round sphere, it's sort of egg-shaped in a way. Cool, so we're doing some extra tests. The first test, so what we're doing here is we're doing what we call an anterior OCT. So an anterior OCT is basically scanning the front of the eye. OCT stands for, I think it's, what does it stand for? Optical coherence tomography. So basically we're doing a scan of the front of the eye. Now the scan of the front of the eye is quite important, especially for laser eye surgery, because what we want to do is we want to scan the cornea. So I'll get my eye model here and just want to make sure it's in focus. So what we have here is the half of the eye, basically. I've taken the top off and we can see this front. It just fell out. I can get the cornea back in to sit there. Great, I don't want to be in focus. There we go, that's perfect. If I do that. Okay, so what we got here is we've got this front layer here. That's called the cornea. So the cornea is basically what we call the window to the eye. We want to make sure that cornea is at a particular thickness. What happens in laser eye surgery is that they use a laser to reshape the front of the eye. That's how you're able to see clearly. Now, the issue is if your cornea is a bit too thin, what happens is the pressure in the eye can cause the cornea to bulge and become misshapen, and that can make your vision really worse. We call that a corneal ectasia. That's what we don't want. That happens if your cornea is not healthy or if your cornea is too thin. So just making sure the cornea is appropriate thickness. So what we're doing here is we're doing a corneal topography. So a corneal topography basically, it's like a topography map for mountains. We're looking at the uniformness of the front of the eye to make sure there's no bulges or anything like that. If there's a bulge in the wrong place for a cornea, that could be what's known as a corneal ectasia or keratoconus. If you have a corneal ectasia or keratoconus, it's definitely not recommended to do laser eye surgery because it can make your eye condition a whole lot worse. Great, so now Ali's seeing the specialist or the ophthalmologist, and he's behind what we call a slit lamp. A slit lamp is basically a microscope that allows us to look into the eyes to make things really healthy. You can see the light there. The light's actually shining onto Ali's lens. So I'll bring my eye model back here. So that's the eye model, if we can get into focus. That's the eye model there with the cornea. So the cornea is taken away. There's the iris, and in the iris, you've got this little empty hole here, which is the pupil. That's the black part of the eye. We take that away, and then that's the lens there. The lens is what allows us, it does a lot of the focusing, so it allows us to focus far away and up close. Usually when you're about 40 years old, the lens starts to get a wee bit thicker, so it's hard to focus up close. And what can also happen is usually 70 to 80 years old, that lens gets cloudy. That's called a cataract, and that's where you remove the eye and put a new lens in there. What's happening here is the ophthalmologist is checking Ali's eye pressure. The eye pressure is really important just to make sure the eye is nice and healthy. And the way we do that is there's actually many ways to do it. One is a puff of air test. This is probably the gold standard of measuring eye pressure. It's called Goldman tonometry. So what we're doing is we're using a little probe just to touch the front of the eye to work out the eye pressure. We do it for both eyes. Before we put that probe onto the eye, we numb the eye with some numbing eye drops first. Usually those numbing eye drops last about 10 minutes. Another thing to notice, which I think is quite funny, is you can see the ophthalmologist, he's got the mask the right way around with blue on the outside, but we've got Ali's mask, which is white on the outside, which I believe is the wrong way around, but I don't know if it's a big deal or not. I thought it was just funny to note. And it's very likely that the mask was pulled down because what happens is when you're checking things start to fog up because when the masks are on, everything starts to fog up. So when I was always in the eye test, people would wear their mask and the lenses would fog up. It'd be just such a pain.
So just had my laser eye surgery consultation. Mr. Ramesh, nice guy, great boy. So they did a bunch of scans of the eye and apparently my eyes are pretty normal. So at some point in the next few months, we're gonna have an appointment to do the laser eye surgery. Yeah, I can't focus on anything within, even that, I can't focus on it.
Yeah, so Ali can't focus on things. So what's happened is Ali was most likely dilated. Dilation involves putting drops in the eye. That makes the pupils really big. But one of the side effects is it knocks out your accommodation. So accommodation is the ability to focus up close and see things far away. So usually when we're about 40 to 50, the accommodation starts to decrease slowly. That's why people need to wear reading glasses to see things up close. Or if you're short-sighted, you'll take your glasses off to be able to see up close. In the case of Ali, he's been dilated, so his up-close vision has been knocked out. The reason the eye dilation is done is so we can look inside the eye to make sure everything's healthy inside the eye. Because what happens is when you shine light into the eye, the pupil will get smaller and it makes it really hard to look inside the eye. And I think another point to mention is because Ali Abdaal has a quite high degree of short sight, when you have a high degree of short sight, your eye tends to be a bit bigger and more stretched out. And that puts you at risk of a retinal detachment. So that's the back of the eye peeling off, and that can result in blindness in the day. So the symptoms of a retinal detachment are flashes and floaters. Another thing to note is if you have a high degree of short sight, you have a higher chance of getting cataract sooner. You also have a higher chance of getting glaucoma. So glaucoma is an eye disease that results in permanent vision loss. It's where the cable that connects the eye to the brain gets damaged. So that's the optic nerve, it starts to get damaged. And if you have a high degree of short sight, you're at more risk of these types of disease. So it's really important to check those as well. Given Ali's age, he's a lad in his late 20s. It's very unlikely that he's going to have glaucoma or cataracts. It's also unlikely he'll have a detaching retina because he's not having any symptoms, but they want to check that out just to make sure there's no problems there. It's a good duty of care, but it's also a good thing to do as well.
Oh my God, I can't see anything.
Yeah, it's funny. So yeah, up close vision will be knocked out for maybe an hour or half an hour. Another funny thing too is it's probably showing over the UK. Those dilation drops make your pupils really big. So that means the light is quite bright. Stepping outside, I didn't really notice a difference. So I think it's probably a dull day in the UK. Great. So that's really cool seeing Ali Abdaal and his vlog about getting a pre-operative LASIK appointment. A few weeks later, unfortunately, I got a tweet. And the tweet discusses how Ali's sort of a bit fearful of getting laser correction. So he put a tweet out there asking for everyone's opinions, and there's a lot of people there sharing their experiences, which is all good, all their anecdotal experiences, but I thought I'd just put my little 2 cents in there. So if Ali saw me concerned about laser correction, I don't know if he would see that, sort of see me in practice, because I do see a lot of people who are interested in laser correction. They just want my opinion on the matter. So I'll give my opinion. So Ali talked about a lot of horror stories. So I'd be interested to hear what those horror stories are. So there are places that do laser correction in the backyard. So most developed countries like New Zealand, I guess the UK, there's laws around doing laser correction that only certain people can do laser correction. However, there'll be some countries where it's not strongly policed, and that's where you can get some mishaps happen. People have told me now it's getting progressively better and better and better. Using surgery to make your vision clearer has had a bad rap. There was a procedure called radial keratotomy, I believe, or keratotomy. So that's where you get the cornea here and you basically get a blade and just slice lines there. And for some people that was able to correct their vision. However, some people did get side effects from that. So some side effects included worsening astigmatism over time, or irregular astigmatism, or eye infections and things like that. So those are the horror stories you can hear. Now the procedures have changed. I won't bore you too much in the details. If you're interested, you can always there's plenty of YouTube videos or material online that you can read, but there's 3 sorts of procedures: PRK, photorefractive keratotomy, LASIK, which is LASEK, LASIK, which is LASIK, and SMILE, which I think is the newest one. So PRK, and that's regarded as one of the best. So it doesn't sound the best, because what happens is they actually use alcohol to remove the most anterior, or the most front surface of the cornea. That's called the corneal epithelium. And the interesting thing about the corneal epithelium, it usually recovers within 24 hours. So if you get a big scratch, as long as it's not too deep, it can recover in about 24 hours to 48 hours. Anyway, they get rid of that front part there, and they use a special laser to reshape the corneal stroma, which is the layer underneath the corneal epithelium. If I'm really getting confusing, don't worry. That's PRK. LASIK, which is LASEK, which is not done that much anymore. That's where they use a laser to create to actually take off the front part of the eye. They reshape the front of the eye, and that recovers normally. And sorry, with the PRK and LASIK, they usually give you a contact lens to put over the top to allow the front part of the eye to heal after surgery is done. So there's LASIK, which is with an eye. LASIK is basically where they create a flap. So they actually use a laser to sort of separate the front of the eye, they lift it open, and they use another laser to reshape the corneal stroma. And they put the flap back on, and then Bob's your uncle. You can walk away freely and see. The other one is Smile, which I'm actually not sure how it works. Someone can comment down below. So they actually don't use a flap. They don't actually get rid of the front part, touch the front part of the eye. They actually use a laser. That laser somehow reshapes the stroma, and then they cut a little slit, and they can suck out the remnants of the cornea that we don't want. So if someone wants to explain that better, then they can. To summarize that really quickly, we don't do RK anymore. That's the one with lots of side effects. We do either PRK, depending on what your prescription is. PRK, which I don't think would work in Ali's case, would most likely be LASIK, LASIK, or Smile. Those are the ones that can be done, I think, with Ali. Given his Ali's prescription would be, when I say an Ali's prescription, PRK can only be done on a certain range. So if your prescription's too high, it won't be able to do it or do it accurately. Shivan again from the future, correcting Shivan from the past. Now, I mentioned that with PRK, it's only done for a certain prescription range. I was actually wrong about that. So I believe LASIK, that's LASIK, can only be done for a certain range prescription. PRK can be done above that. I also mentioned that it's just alcohol with PRK, but it's alcohol to soften the front part of the eye. Then the surgeon uses a blade to scrape the front of the eye off, which it does recover after a while. I think typically LASIK, the recovery time is a lot quicker than PRK. PRK takes a month to get better. Also, there's probably a number of things where I'm not 100% correct, so please let me know down in the comments below. I might do a more comprehensive video later down in the track. Now, I'll leave you guys back to the video. We'll talk about safety. I'm not going to bore you guys with the numbers. So 3 surgeries we talked about, not RK, but the 3 ones that we talked about are actually quite safe. So analogy that a lot of the surgeons give to us to explain to people is that if you were to cross the road to go to your appointment, there's a higher chance of you getting hit by a car than you having a problem with the surgery. So a lot of people would cross the road quite easily. So getting a surgery, especially laser correction, seems quite low risk. In fact, one of my colleagues was telling me that the most performed surgery in the world, which is cataract surgery, that's where they take the lens out in the eye and put a new plastic lens in there, that has more complications and risks than laser correction. That being said, laser correction is not necessarily has to be done. It's not necessary for laser correction to be done. I mean, when you're crossing the road, you actually choose to cross the road. You put yourself at risk in the beginning. So that's a bit of a psychological sort of thing to think about. All in all, the risks are very low. Now, things to consider are, is the prescription stable? So I don't know Ali that well. I don't know if his glasses have changed lots. So if your glasses have changed quite often, or the prescription's changed quite often, it's not recommended to do LASIK because you can get the laser correction done, but your prescription can change in the future. Given Ali's approaching his 30s, I've seen him with the glasses, those particular glasses, for a long period of time. It's very likely his prescription won't change. By the way, Ali, you're a beautiful specimen in those glasses. They suit you so well. So good job picking the glasses. You're a beautiful specimen with those glasses on. So it is a pretty safe procedure. And also what they do is they do that whole preoperative check to make sure that you're a good candidate. So they're checking for things like if your cornea is thick enough or if your prescription's too high for them to actually do. But they've checked that stuff and they've said you're a good candidate. And another thing too with the preoperative appointment, it's really important to discuss side effects with people so they know what to expect. So the common side effects with laser correction is dry eye. Dry eye is a really big one. Dry eye can be quite terrible to have. So that's where basically your eyes don't have enough, they don't produce enough lubrication for the eye. That's what dry eye is. And dry eye can be make things blurry. It can make you blink quite a lot. I'm guessing most of you, because of the situation that we've been in, have had dry eye, and that's where you need to blink quite a lot. The eyes sting, they're always sore, especially when you're using computers or you're reading, and they can be quite debilitating to have. That's one of the side effects of laser correction, which I believe does go away later down the track. At nighttime, you can get a little bit of halos around lights. That's because when they do the laser correction, they're doing a portion of the cornea. So you can imagine at nighttime, your pupil actually expands, so you get kind of the periphery which hasn't been corrected for. I don't know if they'll do it or that's been addressed, but that's something that sometimes can happen. That can be quite annoying at nighttime when you're getting halos around lights or glare around lights. Now, if you're quite scared of laser eye surgery, there are alternatives to that. You can just keep wearing your glasses. You don't have to get laser correction done. So the real key thing is motivation. What's the motivation behind LASIK? Do you want to have a life without glasses? Do you play a lot of sport? Do you have problems with contact lenses where you get dry eye? Do you just not like glasses? Those are really good motivations to get LASIK. I wouldn't get LASIK just for the sake of getting LASIK. And some people have done cost benefit analysis of glasses versus getting laser correction. Some people will say if you get laser correction, you can save money down the track, but it depends on the person. Money shouldn't really be a factor about why you do things for your eyes. Your vision, they say your eyes are the windows to your soul, so I wouldn't do anything bad to your eyes. Now, some other alternatives to laser correction include contact lenses, so you can wear contact lenses. I'd really recommend not over wearing your contact lenses, so don't sleep in your contact contact lenses. Don't overwear contacts. So if you're going to wear them every day, I'd recommend having a day's break or take some time off the weekends. And when you get home, take the contact lenses out to allow your eyes to rest. There are risks with contact lenses such as eye infection, but that's if you handle your contact lenses poorly. That's where if you overwear your contacts, you're not hygienic when you take them in and out, that's where it can be a problem, but contact lens wear is safe. There's also another option called orthokeratology. So we can get that there, please. Orthokeratology, please. So what orthokeratology is, a special lens. So I just said you don't sleep in your contact lenses, but with this particular lens, you wear it at nighttime, and what it does, it actually reshapes the front of the eye. So it reshapes the front of the eye. So when you wake up, you take these lenses out and you'll be able to see clearly throughout the day. Alternative to laser correction or even contact lens wear, because for water sports, for example, you shouldn't really be wearing contact lenses for water sports, because if water goes into your eye, it can cause an infection, especially with contact lens wear, because at contact lens wear, you are at risk of an infection. So if you do get water in your eye, it can cause infection. So orthokeratology is basically a lens you sleep in at night time, you take it out and you'll be able to see clearly throughout the day. And with these contact lenses, so if you stop wearing the lens, your eyes go back to normal. So that's why you got to wear it every single day. Another thing to note is Ali Abdaal is quite high short-sightedness. So how do we stop people from getting high short-sightedness? So there's been a recent research has showed that if you have short-sightedness as a child between 8 and 12, there's a chance that short-sightedness can turn to a really big number when you're an adult. And ways to reduce this is to make sure you get regular eye checks. Another thing too is to increase your daylight hours, so UV exposure, so making sure you're getting about 14 hours of sunlight per week. But it's really important too that you're also protecting yourself from the UV rays of the sun. Another thing too is things like orthokeratology, which I talked about before, that can actually be done for children, and that's a really good way of slowing the progression of short sight, or slowing the progression of myopia, we call it. So myopia is another word for short sight, and orthokeratology is one of the methods for slowing the progression of short sight down. So I hope you guys really enjoyed the reaction video. Comment if you got any questions down below. Here's another reaction video with the scene in Curb Your Enthusiasm. Take care guys, and talk soon.